So, greetings, friends and followers. This is Nurses Talking, and I am Del Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. We'd love to know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing career, from students to retirees and anywhere in between. And today, I'm very, very pleased to welcome Ms. Karla Rodriguez. Ms. Rodriguez is a certified in lifestyle medicine since 2020 and has always been passionate about teaching the preventative and disease reversal nature for plant-based diet. She's also certified in plant-based nutrition from Nutrition Studies eCornell. She earned her DNP from Quinnipiac University, MSN from Phoenix University, and her BSN from Long Island University. Ms. Rodriguez serves as one of the medical advisors for Plant-Powered Metro New York. She is a member of the Office of Global Inclusion at NYU. She's the treasurer of the New York chapter of the National Association of Hispanic Nurses, and she serves as one of the faculty advisors for the student group Latinos Aspiring to Imagine Nursing Opportunities at NYU. Ms. Rodriguez is also an active member of the Sigma Theta Tau Upsilon chapter as chair of the Education Committee. She's currently teaching an undergraduate course elective to nursing students this fall at NYU Rory Myers called Lifestyle Approaches and Wellbeing in Nursing, which is now in its third semester. And she became a certified nurse coach in September. Welcome, Ms. Karla Rodriguez.
Thank you for having me.
How are you?
I'm good. Thank you. We're winding down actually with the semester.
Okay.
So they'll, before you know it, we have the holiday for people who celebrate Thanksgiving. And then the holidays begin, pretty much. They have their finals and that's it.
Okay. Okay. That's cool. So I am usually curious as to why people are nurses. So why are you a nurse?
Yes. Honestly, this was not the trajectory I was thinking of when I was growing up. I wish I could say that I've always wanted to be a nurse. I really did not know what I wanted to be. My mom actually was pursuing nursing at the time. She raised us 4 children by herself as a single mother, and she could not finish the program because of her obligations, with home. And that takes priority. I'm the oldest of 4, but it wasn't really me. It was with the other little ones. So she had to step back. And she actually worked as a ward clerk or a unit clerk at Mount Sinai of Queens. And she's retired now. And she's actually kind of glad that she did not pursue nursing because of what they go through. It's just, doesn't know if she had it in her to do it. But nevertheless, I then took on that role. I was always interested in health. And I saw the many opportunities with nursing at the time. Believe it or not, I graduated late. I'm in my 50s now. And I didn't, I kept changing my degree from one degree to another. So I graduated in January of 1999 with my baccalaureate degree.
Not everyone knows what they want to do at the beginning, or not every nurse comes to it. It's not a straight trajectory for everybody, and that's fine. It doesn't have to be.
Right. Yeah.
It doesn't have to be. So, having come to it later,
yes,
what were the challenges that presented?
So I felt that I was dealt with, I don't know, I felt like it was not too bad. I mean, it's not like, I guess you're asking in terms of being in class with other with
and yeah,
it was actually pretty good. I honestly didn't see that as a challenge, to be honest with you. That didn't come to my mind. I was so focused with just studying, and I was commuting from Queens to the Brooklyn campus at Long Island University. So it was just, working part-time and studying. I mean, that was really a lot of responsibility on my part. And
Mhm.
That's all I was really focused on. I just had tunnel vision with regards to pursuing my degree. And
Mhm.
I honestly just had the mindset of doing well. Yeah. I don't feel like I had honestly, the challenges for me at the time were just like with every other student that I come across, honestly, is just the language, with regards to nursing language and getting accustomed to critical thinking at the time.
Yeah.
That was a challenge for me in just doing that overview of
Yeah.
pathophysiology and electrolyte imbalances, really. That was a
Yeah.
challenge for me.
Mm-hmm, mm-hmm, mm-hmm. Once, well, having done other things, once you became a nurse, was it what you thought it would be?
Yeah. So I should preface by also saying that I did have a bit of experience with because I was also a medical I was a medical transcriptionist.
Okay.
Yeah, so at a clinic, and that helped me a little bit, and I was so interested actually with the gastroenterology, dermatology specialties, and just patient to were nurses at that clinic, but there were also a lot of medical associates. Uh,
Mm-hmm.
and we didn't have nurse practitioners back then, I didn't think
Yeah.
about nurse practitioners at all. But I'm sorry, you mentioned or you asked another question.
No, I was just asking if it was what you thought it
Oh,
would be. Yeah.
yeah, the opportunities are not what they are today. So I ended up first working in a rehab unit.
Yeah.
Um, and it was okay. It's just that it was a bit, um, it was routine, with
Yeah.
regard
It
to,
becomes penile. Yeah.
because in the morning you have to get the patients ready. And I was working day shift. You have to get them ready for rehabilitation, or
Mm-hmm.
physical therapy. So most of those patients had to go to the bathroom. You couldn't get their vital signs done on time. So it was more of a perfunctory role, more so than,
Yeah.
something
Yeah.
that where
Yeah.
it's
There's
free.
no adrenaline pumping in that role.
Yeah, yeah. And it's not free spirited, and patients are in angst, and you have a deadline to meet, or a timeline with regards to getting all these
Yeah.
patients ready.
Yeah.
So yeah, no,
Yeah.
in the beginning it wasn't. But again, I am glad for having the experience. I've actually transitioned to different units. Then I worked on a med surg unit, so I saw a bit of everything. I specialized in both adult and pediatrics
Mm.
populations.
Yeah. Yeah. Are there any any aspects of nursing life that you think you would like to see change?
Yeah. Um, so I think we are a trusted profession, and speaking with elected officials is very important in getting our roles defined,
Mhm.
and maybe getting more of a standardized role, honestly, across the
Yeah.
state. Because
Hmm.
where you're working, which state you're working from. Like I obtained my certification as a nurse coach, but I don't have that ability to coach clients in other states because I'm coming from New York. If I'm
Yeah.
practicing with my license, I can't do that right now. So
Yeah.
it would be nice to be on, just all of us to be on the same page with regards to there's just different roles depending, even I used to work in upstate New York, or I call it upstate, but it was in Poughkeepsie. It's not really upstate.
Okay.
Upstate New York is really Albany.
Hmm.
But I worked like 2 hours away. Um, I live in Queens now. And even the roles are just different depending on the culture of the institution. And just the roles are different, a little different compared to, and I appreciate that. I actually appreciate that. I used to even work in California because I wanted to see what it was like working out west. Uh,
Hmm.
so I definitely appreciate having those experiences. Both, I don't want to say that they were a mix, both positive and negative, and it actually enabled me to see or to determine, figure out what in fact I do like. You know,
Hmm.
and I knew I didn't want that prescriptive role, so I never pursued the nurse practitioner role. I have my doctorate of nursing practice, but with an emphasis on the care of populations track from Quinnipiac.
Yeah, that actually is one of the things that kind of propelled me to create this channel.
Yeah.
Because I had the good fortune to work. I became a nurse in the UK. I've worked in the Caribbean. I've worked here in the United States, and that's one of the things that I know for sure is that although nursing is nursing, what is expected of you is different in different places and in different roles. So yeah, that's one of the things I want, nurses to see that, it's the same all around the world, but the expectations of other people may very well be different, and what you're allowed to do and what
Yes,
you're expected to do.
sure.
Yeah.
Mhm.
So you member of the Office of Global Inclusion at NYU. What does that entail?
Yes. So there's there's a number of different schools at New York University, period. So we are coming from different schools like School of Engineering, School of Social Work, School of Dentistry, School of Education, School of Nursing, School of Law. And School of Social Sciences. So they have, people, not just of brown and black people of color, but just people of other diverse populations. So we get to congregate and share ideas, mentor people. We have presentations. So now after COVID, now we're able to come back now and mix and mingle. So we have events where we can do, support each other. Really, it's a space where we can support each other. Even right now, I'm taking part in an op-ed, where we can share ideas and share our work and creating like an op-ed piece where we can submit some work, and we have a mentor that will, guide us through. But it's again, it's just a space where we can support each other and, share our experiences with regards to the social the space that we're in right now with regards to a lot having to do with diversity, and equity. So there's a lot of work to be done, but we do find some solace and just keep supporting each other. And there's a nice group of us that are involved. So
yeah, that's awesome. And you promote or you plant-based diet. You're a member of plant-powered Metro New York. Plant-powered Metro New York.
Yeah, so that's an organization, nonprofit organization. It's made up of volunteers and just again really with an emphasis on we would like people to be more plant-based, but more so it's about being plant forward. So just having a greater or incorporating more fruits and vegetables, whole grains, only because, sadly, unfortunately, there's about 5% of the US population actually consuming whole grains, whole fruits and vegetables as it is. And there's so many, because of just our environment and what's available for us, whether it's food deserts, and literally, the processed foods are quick and easy, and it's really placing, and we don't want to discourage anybody. And that's one thing I tell students in class with my course is, it's not to vilify anybody, whatever food plan you're on, that's fine. It's just it's not about taking away, it's about adding.
It's about adding.
Yeah, so Plant Power Metric New York is just one network or one outreach that I do that I help, I assist with mentoring people, or we do some group gatherings. But they have so many programs, available for the public. If they want to join, there's a 21-day a program for individuals as well. So it's a great organization here in New York. To becoming plant-based or being more plant-based. You don't have to be.
Yeah. It just seems because when you I looked at it and the word metro is in there. And when I'm thinking of Metro New York, I'm thinking of hard city streets and supermarkets, and
Come on.
I'm not thinking of um the 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 plant-based kind of thing, and how easy it may be or not be
Yeah.
able to be to get the kinds of things that you would want to have
It's
in
very
that.
easy. People think of, or, people, even with coaching right now, the main reason people see coaching, or they're mostly women, and they mostly want to lose weight. And
Mhm.
anyone honestly can lose weight. Any type of, I don't like saying the word diet, but any kind of food plan you're on, more than likely has no processed foods in it. When you're on a food
Yeah,
plan, when you're following a food plan, more than likely it's not too much of that. And anyone can lose weight. It's just keeping it off. Is it sustainable for you? Maybe being exclusively plant-based is not sustainable for you. And that is
right.
fine. That's fine. It's,
Yeah,
you know, but
yeah,
unfortunately, we're living in a society now where it's based on non-communicable diseases, heart disease, diabetes, cancer.
yeah,
A lot
yeah,
of these are, conditions are attributed to lifestyle. And I mean that, and we are making changes. I work, at Roy Myers NYU College of Nursing, but I'm located across the street, pretty much diagonally across the street from Bellevue, which is one of the New York City
okay.
metro hospitals, actually,
Hmm.
health hospitals, that has instituted a plant-based lifestyle program. And I actually have observed, or was taking part in that, in the sense of just observing the doctors who was plant-based, interviewing or doing an intake history on patients. These are patients who the criteria is to be pre-diabetic.
Yeah,
And there's a waiting list of like 800 individuals, and they have to be referred by their primary, whoever that may be, whether it's their healthcare provider.
yeah, yeah, yeah.
So, and
Wow.
now there's another, there's like 6 locations now for plant-based lifestyle programs in the New York City metro area. So,
Okay.
and again, it's really about incorporating, because I can tell you now that the individuals who do come in, they are still consuming meat, or they're still consuming fish, but not as
Mhm.
much as before. Or they're being more careful of the foods they do choose, and learning about substitutes,
Yeah,
in a good way, in a good way.
yeah, yeah. And that's the kind of thing that actually takes time. It has to grow on you, so to
Yeah.
speak. Yeah, it has to grow on you.
Mhm.
So, as we're talking about, improving our health based on what we're putting into it and stuff like that, when I speak to nurses, one of the things that comes up all the time is um, burnout. It's dissatisfaction. It is people leaving the profession, and I agree. When I ask the reasons, people talk about things like bullying, things like short staff, things like, you know, um, not shortness of pay and overwork and too many patients and all of that. And those things are real and they do contribute to all of this. But I'm thinking that in addition to that, one of the things we're not paying attention to that also contributes is our lack of self-care. I don't think that we take care of ourselves in a way that we should or could. So,
Mhm.
what does self-care mean to you?
Yeah. That's a very good question. So again, in order for us to take care of others, we need to adopt characteristics or do a check-in with ourselves.
Yeah,
The same type of teaching that we provide patients or how we talk to individuals, are we taking that same time and energy with ourselves? So, a patient can have, or a condition such as diabetes or heart condition or arthritis or autoimmune condition, but how did they get there, especially when there are those insidious type of conditions? It just didn't occur overnight. So again, looking at your environment, what self-care means to me is doing the best that I can in taking care of myself. It's not a cookie cutter type of program. So this is like a learning curve. I can tell you
Right.
that. It's a
It's
learning
it's
curve.
not a it's not cookie cutter. It's different for each person. It's different
Yeah,
for each person.
but if we
Um,
equip individuals or students right now with at least the pillars, with something as simple, it sounds simple, but something as simple as sleep, what your sleep is like, what is, doing some type of sleep diary or
yeah,
investing in type of sleep diary or physical activity. Note, I tell students this, it's not about exercise, it's about movement and not being sedentary.
yeah,
And nutrition, that is a very personal to people and very sensitive subject. Everyone has, their food patterns and their,
yeah,
with regards to intake. So what is that like? Is that serving you in a good way, or do you want to make changes?
yeah,
And stress management. Well, you mentioned burnout, so a lot has to do with stress.
yeah,
And it is hypertension. A lot has to do with stress.
yeah.
So, the Nurses Health Study also, since its inception in 1976, just looked at characteristics with regards to the relationship or correlation to chronic health conditions over time, was prospective studies on nurses. Just to look at the relationship between cancer and oral or the use of oral contraceptives and smoking and alcohol use. And the nurses were the best participants. Why? Because they answered truthfully.
Yeah.
And they do follow up, with regards to documentation and just filling things out. So, and men weren't allowed into the Nurses Health Study, believe it or not, until 2010. Yeah.
Ah, that I didn't realize. 2010. Huh.
Mhm. So
Okay.
I don't know if I answered your question, but well-rounded. In my class anyway, I always, we start off with some sort of, we try, it depends on the day and how we start off, but we try to do a check-in, and it's really about them. And I want, we want to hear from you and make it an engaging type of discussion, and speak on gut health and its
Yeah.
relationship with the microbiome and autoimmune conditions, and how sleep can also be altered. And when sleep is altered, how some of these hormones can also be altered. And as a result, you're not feeling as satiated, and you have more of an increase of ghrelin, which will, having more hunger as a result. So everything plays a role. There's like a web, between
Yeah.
organs and communication. There's more than, to speak than just what meets the eye, with regards.
Exactly. 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 So intricate and
Yeah.
so interdependent. Each thing is so
Yes.
interdependent on the other.
Yes.
What advice would you give to someone who wants to be a nurse?
So the many opportunities that are available now, I believe it's over 40 careers in nursing. There's just so many careers now are available. And we don't, it's not by default, you don't need to work in a hospital. You don't. There are other occupations available for entry level nurses.
Yeah.
So,
Yeah.
students that we have now in their first sequence, as an advisor to some, each full-time professor is assigned a number of students. And we ask them, do they like what they're doing? Do they like their clinicals? Do they enjoy the courses? Do they enjoy having that communication or that contact with individuals? Because you have to want to do that, right? I don't think you have to, though, because you can also somehow be indirectly involved if you wanted to at some point. You don't have to work in a hospital,
No, you don't.
Yeah, I guess you could. So what do you want? What do you want to do? And there's, if you want nursing, again, there's beauty in that. There's just many opportunities available, whether informatics, for instance, right?
Yeah. Yeah.
You don't
Yeah.
necessarily have to work with the patients, direct
Yeah.
patient contact. So the image of nursing has certainly changed.
Yeah. And that's one of the things that I want both nurses and consumers to see, is that nurses can be everywhere. Nurses are, not can be, we are everywhere. And that, our roles and our education, our experience, when we come to you as a nurse to a patient, if that's where we are, we bring a lot of stuff with us. We bring a lot of knowledge, we bring a lot of experience, with us.
Yes.
Yeah. So I am asking, I'm collecting these words, and I started collecting these words because I realized that I can see a nurse that I never met and know that she's a nurse in a different setting. I know that she's a nurse, and so I started to wonder, what is it that I see or other we see in each other that we recognize each other without being told. And so I'm asking the question: if you could describe the most essential quality of a nurse in just one word, what would that word be?
I guess one of the characteristics is maybe quintessential, just
Quintessential.
throw it out there, because you always hear about them being empathic, having these characteristics, having humility. There's these attitudes of nursing, with regards to the nursing, not the nursing process, but the standards of nursing. Mm-hmm. They're called attitudes, but it's really characteristics that nurses should will be equipped with. And discipline is one of them, integrity.
Yes.
So being creative. So I think, I don't know, what's coming to mind is quintessential.
Yeah. Yeah.
There's that opportunity. There's an opportunity for nurses to evolve.
Yes.
And learn from their not mistakes, but just learn. They're going as with anything else in life, like a path. What path are you choosing, and is this where you want to stay? If you're not happy in your career, whatever the case, wherever you are in your career, then perhaps that area is not for you, or whatever, in that environment is not for you. Maybe it's a toxic environment. So what changes could you make? And it is possible to make changes.
It is possible to make changes, and becoming easier and easier to do so. I'm so encouraged by nurses pursuing different roles and the higher education, because it really means to me that we will find ourselves, we will at least recognize and accept and be more comfortable with our power, because we have power.
Yes.
And I don't think that we actually use it. We don't have to use it in a negative way, but certainly I think that we can recognize that we are a powerful group. And if we had recognized it, I think, first of all, we would not, I believe, have this thing where everyone's wanting to leave, because we would have empowered ourselves to advocate for ourselves better than we have. I know that we have the unions, we have nursing organizations, and all of this. Something is missing, that we're not empowering ourselves to advocate adequately for ourselves. And I see that I think we're getting there, that we're heading in that direction.
Yeah, we need to support each other. And because we're mostly made up of women, I don't know what
That's it too.
I think, we need to, there's so much room for everyone to, there's just so many opportunities available for everyone. No one's going to take this from you,
exactly.
No one's going to take it from you, because there's room to grow, and there's a demand for what you are, pursuing for, and what you want to take part in, to be honest with you. So, you mentioned with regard to burnout at the bedside, I can't even imagine what that was like during COVID. Honestly, I wasn't working in the hospital, but I do take students every now and then to clinicals. And I just took students over the summer for the pediatric rotation, because again, I was a pediatric nurse for a while as well. And I do, I still see the veteran nurses. The veteran nurses have hung around.
Yeah.
They're still there. So I don't know. I think it's just it could be the generation themselves, that is just, I don't know if we're preparing them enough, or it's not for them, but you see more of the veteran nurses who haven't quit.
Yeah. I'm glad to talk about preparation, because my impression of one of my impressions is that, people are prepared for being nurses, but the preparation, but nurses, let us say 10 years ago, when nurses coming out of nursing school, what's expected of those nurses is different to what's expected of nurses coming out of nursing school today. Healthcare, the atmosphere, the atmosphere is not the word I'm looking for, but healthcare itself has changed. Healthcare 10 years ago, or a little more than 10 years ago, when you came out of nursing school and you worked in maybe a hospital that belonged to a small group, maybe. Healthcare, you come to a hospital today, it belongs to a conglomerate. It's very corporate. And so the atmosphere in which you work, the environment in which you work, is much more corporate than you were prepared for. You're prepared for a healthcare environment, and you've come out of school into a corporate environment. And somehow you've got to adjust to that, and adjust very quickly.
Right. No, I agree with you. Nothing against medicine and advancements in medicine.
No.
Also a purpose, but
it's just the way it's evolved.
And in you coming from the United Kingdom, I'm sure it's much different there than it is here, right? So, so it's, how is it? It's driven by corporate,
Yeah.
So, is that what maybe initially it's good, it's great experience, but again, there's this demand for nursing. That's great, but why? Because there's more sick people. Is that necessarily a good thing?
There you go. It is necessarily a good thing. I don't know. There are so many aspects to this, so many things that affect the whole cog of this, the whole wheel, that it's really hard to pin down something at once sometimes. We can only, I suppose, work at those little corners and hope to come together in some way.
Yes.
And that will happen. That will happen with so many nurses, again, taking on so many different roles.
Yes.
It'll come together.
Yes. Yeah, I agree.
So thank you so very much. This has been quite a conversation. It's taken a little bit of a different path, because we talked about things like plant-powered New York, and inclusion and those kinds of things, which we really need to speak about a little bit more as we go along. So thank you so very much for this.
Thank you for the opportunity, Ms. Dale. Thank you so much. I appreciate it.
It is my pleasure. It really is.